Hi folks, this is Saryam for CWinner. Today we are going to do another episode on non-specific back pain. Today I'm going to talk about one part of the management, that is reassuring your patient or educating your patient about the disease as such, as well as the pain also. So you all know that all diseases have a biological component, a psychological component, and a social component. So to address the psychological and social component, reassurance, education, all these things are considered vital, right? So that's what we are going to see in this episode, right? So to start with, we are trying to define what is non-specific back pain. I have taken the nice guideline definition. Remember, non-specific does not mean that there's no biological reason. It means that it is difficult to identify properly what is the specific cause, whether it is the disc or connective tissue, joints, whatever it is. It is difficult to define, right? And also remember, in this video we are going to talk about only about the acute part of it, because in the chronic part of it, the education, the psychological and the social issues are have to be managed in a far more complicated way than what I'm going to say today. This is only about the acute part of the back pain, right? So this is what I mean by non-specific back pain. Now what happens is, as I told you, all patients, if you have any disease, you'll have questions about that. When will I be all right? Will I go back to my home? When will I be going back to my home? Do I have to eat the medicine as long as I have to live? That kind of questions, right? Like in diabetes and things like that. Will this disease ever go out of me? That kind of things, right? So there are also some questions your patients commonly have in case of back pain, which can be, will it get better? I'm so young, how did I get it? My father doesn't have it, but I am just 25, but I am having it. Will I always be like this? Will my back pain be always with me? Will I not be able to go back to my job again? Can I go back to my original job? I'm sitting all the time, that's why I'm having it. I'm always driving, should I change my job? My x-ray is showing that all the joints are worn off. These are the questions your patients will have, especially in the acute setting. Remember, I have not given the whole list, I've just given you some of it, right? Right, so the next thing we need to understand is when you have these kind of issues, if you have a back pain, you have some amount of anxiety. Here, I'm not using anxiety in the term of sort of a psychological disorder or something like that, where your heart rate is going terribly fast, you're unable to concentrate, that kind of thing. But in a more literal sense, right, you're feeling nervous, slightly unease, probably some amount of heart rate is also increasing, because nervousness and unease definitely leads to some amount of increase in the heart rate and things like that. And mostly you are worried about what will happen to me, what will be the outcome of this problem, right? So what we are trying mostly in case of acute back pain is trying to reduce this anxiety of the patients with back pain. Remember, in a biopsychosocial model, the biology interacts with the psychosocial model, psychosocial factors, and makes the biological model look larger, right? They are all interdependent. They cannot be separated. So if your patient is anxious, his pain will naturally be higher, right? Right. So we also want to remember. We also want to look into other parts of the other part of the problem. that is, what are we going to do for this anxiety? What are we going to do for this, the issue of this anxiety coming from this affliction of this disease of low back pain, right? And that's what we call it as patient education, or simply as a reassurance, right? Remember, information is the key, right? Information or knowledge is very, very important. And the right kind of information and right kind of way of saying that, right? If you are giving it in a positive way and you are telling them in a proper manner, that is considered as a reassurance or education, right? That's what we are going to understand in case of people with back pain. Right, so where are these information coming from, right? Naturally, it's coming from the social media, the therapist. If you don't have to be offended, I'm also in this in the picture. The surgeons, the doctors, who all have a stethoscope, they all have some sort of need to talk about all these nonsense. The media is like the magazines, which is written in the magazines, or I just went through some parts of what they call as Anandavidan, which is a Tamil magazine, where they have a part called as Dr. Anandavidan. Most of it is utter rubbish, and the other part is fully rubbish, right? We hardly have good information which is written in magazines. So all these things are a rich source of information for people to learn nonsensical or misinformation, right? And also, common thing in, I don't know about other places, in Tamil Nadu, a lot of people come and tell me that I ate a lot of gaseous things, that is potatoes and things like that. Did that lead to my pain and things like that? So you want to understand where your patient is coming from, right? Right. So what does the next thing is what to do, right? As I told you, reassure your patient. That's what you want to do, and that is all to this video, right? There are some very good systematic reviews. One in 2016 which says that reassurance works very well. Later on, they did a study on 2019. It's not a systematic review, but an RCT did not give much of help. So the evidence is iffy, but don't worry about that. The available evidence seems to be slightly moderate, and it is good for us at this point of time. Okay, what is the systematic review telling us? Mostly it is in three parts. One is tell your patient that they have to be active. That is the most important thing. And the next thing is, or the first thing is, you have to tell them that back pain is benign. It is not because of this happened to your disc, or that happened to your ligament, or this and that. All sorts of specific reasons. Don't give that. That seems to be one of the important things in all the RCTs which they have included in that. And also about the imaging, they have told us most of the education is about, don't worry about the imaging, that is not a problem. That kind of things are considered vital, right? So these are the three major issues. There are a lot of other things you can add, but these are the three major issues. So how do what I mean by I is, this is definitely me, right? There's nothing, because the evidence is not telling us the dosage and how to do it correctly and things like that. There are slightly some confusion. There is one book most of them used, is called as All About Back Pain or something like that. I can share it if you want. That's a simple book which most of them used in it, in the information. And all the information which I showed in the earlier, these information, they are all given there in it in a very simple format. Right, so how do I deliver that? Mostly we say that like cold, we don't know what causes cold, but we know that it is not a big issue. We know how to overcome that. We know how to manage that kind of things. We also say that don't overthink that this is causing you, that is causing you. We don't know why you get diabetes, but we know how to manage diabetes. So these kind of things are one of the common things we say. Uh, we also teach about the structures which are underneath are very, very strong. If they are fairly educated, we tell them that the tensile strength and the beams which are in our building, right, the beam which they use to build it, your ligaments are as strong as that beam, right? The tensile force between that and your beam is nearly same. That's why I keep on saying you can't stretch anything, right? And also tell them about the biopsychosocial part of it. What do I mean by that is, say for example, if you have headache, right, and if somebody is singing some nonsensical song, or somebody is coming and saying that, or if you are married and your wife is like, right, so that kind of thing is happening, your pain becomes bigger, right? So likewise, your back pain also gets bigger, or it looks larger when you have when you are not eating properly or when you are not sleeping properly. So tell them about eating and sleeping as a very important part and parcel of your management. And tell them to be active. And one of the common things which we say in our clinic is any joint, right? Any joint by definition, if they have to move, then only they are good for us. If you have a cycle at home and if you keep it and if you just keep on dusting it, it still is going to be a useless cycle, because you are not driving it, then only it becomes better. Likewise, if you have a door and if you are not moving it, it is not going to become useful anytime soon, right? If it is always locked or if it is always closed, it's going to get stuck. Likewise, if you have a joint like this and if it is moving like this, right, the pressure is always distributed rather than always having it in the same place. So we tell them two things. One is to move, move, and move. Another one is not to be sitting in a static posture for a long time. As I said, if you are sitting like that, the pressure will be on the same place and the joint has to move. Then only they produce synovial joint. The common example again we give is, if you want to produce saliva, saliva is produced when you're talking or when you are seeing food and when you're eating. They don't produce when you're just sitting, right? Likewise, your synovial fluid, whatever things which has to happen inside the joint happens only when you're moving, right? And just to make them understand these things, right? And the common thing again a lot of people are afraid about is the X-rays, right? Always tell them that X-rays always, or the first thing tell them that X-rays are for one thing alone, that is to rule out fractures, right? It is not to rule in anything, it's not to find out. And for that, in Tamil we say that Alavaliyam Palvaliyam Tamakondan Theriyum. What it means in English is, you have to experience headache and toothache to know what it means. What it means is basically it's a perception, and perception cannot be photographed, right? You can't take a photograph and tell me that this is what it is. Likewise, X-rays cannot find out that. Then they'll ask you, but I have seen the X-ray which is where the joint is worn out. Of course it is. If you have a bike or a car, your tire will be worn out. That is basic physics. What is the difference between your bike tire and your joint? It gets worn out and then gets better. That is, it gets regenerated or repaired. That is basic biology. Your car tire or your bike tire cannot, right? So you just change it. So don't ask them not to worry about that. And even if they are still worried, the common example which I gave is, I have a phone, sadly I didn't bring it, which is, when you look at it, it looks very clean, it will be very shiny and things like that. And if I show you that phone and tell you that is it a good phone, people will always say it's a good phone, right? Now we all know that is not how to find the the quality of the phone, right? So the picture of a phone cannot tell you how the phone functions. Likewise, a picture of your spine cannot tell you the functioning of your spine. These are some of the ways to educate your people about back pain and to reduce their anxiety. Remember, this is only in acute, and this is not the whole thing. This is just some part of it. Because a lot of times in our clinic we always start with, why do you think you have back pain? If they tell us that these are the reasons, then we can tell them why they may be correct or may not be correct, right? Those are all, there are a lot of ways of doing it, but just a glimpse of what to be done, right? So if you have any questions regarding this video, please comment on this. I'll be happy to share it, because as I told you, there are a lot of things we have to tell, but I have just given only the finer points. Thank you so much for watching this video. If you want to watch more videos like this, subscribe to our channel. Thank you.